Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Good morning to you. Pleasant good morning. Good morning. I know that you have missed me. I have not been on air for the past 2 weeks, and I know that I was missed. But it is a pleasure to be back here with you for yet another episode of Health Vibes on this rainy, cool Wednesday morning. I am not too sure about you, but I am enjoying this type of weather. After this, wow, almost from February, we've been having this heat wave. And so I personally welcome this type of weather today to cool down the place. Usually, I always say when the weather is like that, some way, somehow, it makes us very melancholy. It brings a sense of tranquility and peace and almost quietness um, to us. I know generally when it's like that, you just feel calm and cool. But I'm enjoying it. Truly, good morning to you.
Carlton, good morning to you. And of course, good morning to our listeners on the big station Q95 FM. Carlton, you said you know you were missed. Yes, you were missed. But Carlton, you could have waited for me to tell you that. You could have waited for me to tell you that you were missed. And I just wanted to, to extend wishes for World Pharmacist Day, which was on Monday.
Yes.
And of course, I know that you and your colleagues at Jolly's Pharmacy, you all enjoyed that day. But I want to extend, I guess you'd say, belated wishes for all the pharmacists, including you, Carlton, who do a tremendous job at their profession.
Thank you so much, Trudy. Thank you. We are humbled. And we always say it is service to humanity. I don't think no amount of money can be equivalent to the work that we do, particularly when we do it generally for free. We are oftentimes seen as the first healthcare provider that is most accessible to all. And guess what? Oftentimes you don't have to pay a cent to have a conversation with us. And whilst we make our assessments and recommendations to you. So it was a wonderful day. Let me again thank Miss Hill and her team from the government sector, the pharmacy division of the government, who really worked tirelessly to put together a lunch at Intercontinental that was held on Sunday
Okay.
afternoon, where pharmacists from all over Dominica met. We would have loved the crowd to be a bit more, but nevertheless, those who turned out, we really, really had a good time. And I really want to thank Miss Hill and the other members of her team who really put this together.
Yeah.
It was really, really a good occasion.
I saw some pictures. You all look
Yes.
like you had a good time.
Yes, it was very, very
Yes.
good. It was good. So Trudy, it is, as I said, it is a Wednesday morning here. It's quite overcast and wet on the outside, but needless to say, we are here in the studio and we are going to have fun today. Let me just say in opening that unfortunately, we have had to postpone the sex symposium, which was scheduled for tomorrow. The reason for that is because of the electricity issue, which is very, how you want to put it? It is very unpredictable.
Yes,
That's the word I want to
yes,
use.
yes.
It's very unpredictable. The place that we had scheduled to use does not have a generator. And so that creates a bit of anxiety for us, not knowing if whilst we're there, the electricity just goes off on us. And so we have decided to not cancel it, but postpone it for a further date. We will announce that date. Those of you who would have purchased tickets, You can decide what you may want to do. If you want to hold on to the bands still, you can do so. Or if you feel like you may want a refund, you can feel free to come to any of our branches where you would have purchased the tickets to get a refund. But again, as I said, we have cancelled. We have
Postponed.
postponed, yes.
Mhm.
We have postponed the sex symposium for a further date due to the electricity situation
Mhm.
that we're facing here in Dominica. And we know that it's affecting all parts of Dominica.
Everybody.
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 Last evening, I was going home, and practically all of Central Rosa was without
Yes,
electricity,
yeah.
and it just looked so weird
Mhm.
driving through, and just seeing driving up King George V Street, going up Astafan side, everywhere is total darkness.
Dark.
It was something else. But we hope that there will be a solution to this situation very, very, very
Yeah.
soon. We really want that to happen.
Call it a situation. I call it a crisis.
Yes.
And it's not one that I or anyone else is enjoying at all.
At all.
And so yeah, I really hope a resolution is come up with immediately. I mean, it's been too long
Yes.
to be dealing with this
And we're
level
really
of.
getting into the heat of the independence.
Of course. And as you mentioned, the level of uncertainty that you are faced with every day. You cannot plan. You cannot plan. And, for people like me with a personality where I like to know what is happening at all times, you are thrown into a state of, complete discord. You don't know if you can have your event, your class, everything is just thrown into a.
Yeah, because can you imagine you're studying online?
Mhm.
You're doing your studies or and this is just happening. You have no control over it,
Mhm,
and you
mhm.
miss your lectures, and so it's really, really a serious situation.
Yeah.
For especially small business owners.
Oh yes.
You
Oh,
don't
yes.
have electricity. There is nothing you can do. You may have a food business. No electricity. You don't have a generator. Sometimes where you are, you cannot even put a generator there as such.
Mhm.
So it's really something that we really hope will be dealt with
Resolved,
as soon
yeah.
as possible. Truly, this morning we were supposed to have Dr. Ken Jacobs with us, consultant urologist. Unfortunately, he had a situation too, as well, this morning with his vehicle, and has called in to say that he really cannot make it to the show this morning as much as he really wanted to be there. Up to yesterday, we spoke, and he was really excited to be in studio to talk with us. But unfortunately, we won't have him this morning, but I'm sure at some point we will have him. He wanted to really come in to talk about prostate cancer and the prostate gland and its function and all of that. Seeing that the month of September has been Prostate Cancer Awareness Month. As I've said in the past on numerous shows, that prostate cancer remains the number four major cause of death here in Dominica. And when we talk about prostate cancer, we're referring to a cancer that is specific to men. And so if we're talking about the number four, the fourth major cause of death on Dominica, so you can imagine the number of men who die yearly from complications of prostate cancer. And so, again, as the month of September wraps up, we want to really encourage all our men who have passed the age of 40 to really begin to not just maybe consider, but have that conversation. Most of us do have smartphones. It is important to do some reading. If you are literate, do some reading on the prostate gland, do some reading on prostate cancer, know the facts about prostate cancer. It is a bit, I don't want to say, well, I would say ignorant for you to take the word of somebody who is not an expert or may not even be medically inclined to tell you, well, this, that about prostate cancer, and believe it when you know, or you believe or you suspect it may not be a fact.
Mhm.
So ensure that you get the facts about the disease. Ensure that you have your yearly screening. If you are eligible to get screened, ensure that you do that. Be truthful to your doctor. That's important. Be truthful to your doctor. Know that most medical examinations and interventions may come with some discomfort. You want to know what your blood type is, you will have to get
Yeah.
an injection.
Mhm.
You want to, you're not feeling well, they have to give you drips. Of course, your skin will be punctured with a needle. You had an accident, your leg is broken, you will have pain. So most of these medical procedures you will experience some sort of discomfort. So yes, you have to check your prostate. You have to go to the doctor. The doctor may have to insert one of his fingers into your rectum. It is not a violation of you. I don't think no doctor enjoys doing something like that, knowing that's the same finger he's going to pass on his face later down, even if it's in a glove. So think of it that way. But that's the only way that the doctor can access your prostate. And so the integrity or the texture of the prostate says a lot about what's happening to you and with you, because the prostate, from all information, is supposed to be a smooth organ. So it's supposed to be smooth in texture. If it's rough, if it's bumpy, if it's feeling grainy, then it is suspicious that something is not right.
Or if it's enlarged.
Or if it's enlarged,
Mhm.
it means that something is not right. And that's the only way the doctor is going to know. Yes, you may do the PSA test, which is basically going to be testing the antigen level, all right, which is a type of hormone. So it's going to be looking at the concentration of that hormone in the blood, but it does not basically give an indicator as to the texture, the physiological texture of the prostate gland, and hence the reason why that test is essential. It is. I have done it. It is something that takes less than 2 minutes. Believe it or not, less than 2 minutes. It is not something that's going to make you cry. It's not something that's going to. If the doctor is trained well, the doctor would normally have a conversation with you to relax you. And guess what? Within the 1 minute, you may not even have felt anything so major.
Mhm.
And so I'm really, really saying that 2 years or 6 months or 1 month of intense pain and suffering does not equate to 1 minute of a mere discomfort.
Discomfort, yeah.
So let's get going, men. Let us change that number where we are, or statistics are showing that that we are making up the fourth major cause of death in Dominica, and that is complications of prostate cancer. Within the year 2009 to 2019, we remain number 4 as the number 1. That's the main cause of death in Dominica. And so we really need to, you know, take out that ignorance from our head and stop fooling our heads with foolishness, and recognize that many of us could be here. We could be on the land of the living. We could have our feet up, enjoying our retirement in our homes that we've built with our wives. Instead, many of us, because of our ignorance, we are heading to the grave prematurely. And guess what? Most of the times, our wives end up remarrying, and somebody come with a nice suitcase filled with clothes and take control of the work of the house that we worked so hard for. Let's hear what this caller has to say. Good morning. Good
Yes,
morning
good
to you,
morning,
caller.
Carlton,
Good morning to you.
and to your co-host.
Yes, good morning.
I have heard you and Teacher Lufa and Dr. IP speak about the test is less than 2 minutes, and I've had it done, and it really I really cringe when you hear you say less than 2 minutes. I mean, a minute and a half to an exam of that nature is a lot of time for that to be happening. So I don't think it should be said that is less than 2 minutes. That happens in less than 30 seconds. You understand? So I think that's what you all need to start turning to, because a man to have a finger inside him for a minute and something is a lot of time. Good morning. I'm listening.
Good morning. And again, I'm liking your comments. So you've even made it simpler to all our men who are listening. As the caller said, it may take even less than 30 seconds to be done. And 30 seconds cannot, because when you talk about prostate cancer complications, Trudy, and we're talking about a man who wants to urinate and cannot urinate, a man who is urinating and clots of blood is coming out from his urethra and it's blocking the pathway, and he feels that his bladder is bursting. He wants to pee, and it's very painful. A man who is screaming out because the cancer has spread and it may have spread to his bones or to another vital organ of his body. Sometimes it even spreads to the colon, to the rectum, and you cannot pass stool. You have blockage because the tumor gets all there, and you end up having a backup where sometimes stool even comes out from your mouth, all the way it backs up and it comes back right back from your mouth. I've seen situations like that. And these are some of the complications that can really occur. And it may sound gross, but it's the reality. I mean, if you have cared for somebody who may have had prostate cancer, it would be nice to call and maybe share with us what it was like caring for your brother or your husband. You yourself, the caregiver, cannot sleep because whole night your husband might be groaning. If he doesn't have morphine or pethidine or some strong painkiller, he is crying for the entire night. Think of, he may have had situations where he end up having to use diapers. You have to do everything for him. You have to, bathe him. You have to brush his teeth. You have to change him. You have to make sure that he's comfortable. That could be a man that could be in his early 60s and still can work, still can be productive. And right then and now, the family now, the economics of the family is now compromised because the main breadwinner is incapable of working, and that woman has to wonder, do I stay home and take care of my husband, or should I go and find a job? And so you see the complexities with this. You may have them with young children who are still at school, right? And so that is the reality. So it's one thing to say, well, I am afraid. Women could say the same thing too, that they're afraid. And for women who have given birth, they can tell you the number of times their doctor or doctors have had to examine them and insert their fingers inside of their vagina to get to the cervix to touch and feel certain things. And they will tell you it's not the most comfortable thing either. But they have to do it. They have to do it. You go for your pap smear, you go for your regular examinations by your doctor, and you have to do it. So we have to recognize as well that we cannot be stupid. We cannot be stupid. We cannot be ignorant. We have to really, really know the facts, and we cannot be selfish too. Where you just think of yourself. You think of yourself. Your wife, your girlfriend have been speaking to you for many months, sometimes even years, and telling you, John, when are you going to have your prostate check? John, when are you going to have your prostate check? And you keep on procrastinating. It's like it's not an important thing to you. And at the end of the day, you have your child who would have done well at university, about to graduate, and you are on a dying bed. You cannot make it to the graduation. Your child is feeling hurt and disappointed that you are in a situation where you cannot make it to the graduation, and all of what you would have worked for to make sure that your children achieve and become somebody important in life, you are not there to celebrate it. And that's the reality. So sometimes I like to paint the picture like that so that we can see for a fact how these one simple screening can save your life.
And Carlton, yesterday I was at a funeral, and obviously at
I looked at it
funerals,
too.
you always reflect on life. You know how fragile it is. How easily it can be taken away, and you also reflect too. Well, for me, on how small decisions are the very small sometimes decisions are the distinguishing things between life and death. So it's a small decision to go and have a screening done, but it could be the line between you having an extended life or you having a life that is cut short. So you think sometimes that decisions are small, or that they are irrelevant, but in reality a very small decision could be the difference between life and death.
And that is so important. Let's say that you are hypertensive, and you've been hypertensive for a while, and your doctor just felt like doing an ECG on you, an echo, just to make sure that your heart is working well and all of that. And the doctor says, well, we are noticing that your heart is enlarging because of the force of pressure on the heart. Now, if you were not going for your checkup regularly, how would you have known that?
Right.
I cannot look at your chest and say
see.
your heart is enlarging. Right? Now that you know that your heart is enlarging, you can begin to you could ask your doctor, well, doc, what does that mean? How much does it put me at risk? What can I do to at least, prevent it from further expanding? You can ask questions. And that is why the screenings are really, really important. There are medications that can be given. Many men have enlargement of the prostate, and it does not mean that they have cancer.
Yeah.
And that's a big difference. It doesn't mean that they have prostate cancer. It's just that as we age, the prostate can enlarge, and from time to time, it can begin to enlarge. The aim is to minimize complications, whereby, for example, you have difficulty peeing, or you find that when you do pee, you think that you're done peeing, you put your penis back in your underwear, and
you still have that trickle.
You have that trickle. Time you put it back in your underwear, all your pants wetting down. And that is why sometimes, I always say to younger people, do not laugh our grandpas. You may have a grandfather, or you may come to church and you sit down by an elderly man in his 70s and you smell a little pee on him, and and you want to make him feel uncomfortable. It doesn't necessarily mean that he didn't shower before he came to church. Oftentimes it's because of these issues. They are more likely to have bladder problems. They are more likely to have prostate issues, and because of that, they could be having a bit of dripping in their underwear. And again, because of the concentration, they are more likely to have dehydration. They oftentimes don't drink enough water, so the pee will have a stronger smell. So don't discriminate them. Sometimes it's just a matter of having a conversation with grandpa in a very nice, civil way. Maybe sometimes he doesn't even know he has a prostate problem or a bladder problem. So you can speak to him very well, and maybe even encourage him to go to the doctor. So it's not something that we should be laughing about and making the elderly feel uncomfortable when we recognize or we see something of that nature.
And Carlton, when we have these type of discussions, I always like to tell people, right now, there are so many opportunities to get yourself checked. It's not even a difficult or inaccessible thing to do. So this is Prostate Cancer Awareness Month. I have seen several physicians actually offering free prostate screening tests. Like I saw Dr. Emmanuel doing so. I've seen labs offering discounts on the prostate specific antigen test, the PSA test, that's the blood test. So I have seen the health system, try to encourage people to have these things, to have this checked out. I know the health centers, the clinics.
Even Dr. Jacobs, I saw he had a post for 3 days where he was doing free screening.
Right.
To pay.
So people, sometimes use one of the excuses is, I don't have money to do that, or I don't have, I don't know where to do it, or I but the information is out there. The physicians are, putting themselves forward, offering this. They offer it normally, but they're saying, during this specific month, they have, free screening available. They have discounted, as I said, at the labs, discounted rates for blood tests, for the prostate specific antigen. So the health system and the whole network is making it easy for you to have this screening done.
And again, wives, girlfriends, is not a joking matter. And a lot of the times we make fun about these matters and we discourage our husbands from seeking particularly this particular tests because we laugh them. We make fun and say, well, oh, you're going for the doctor to do that to you today. I should be there to see your face. We make fun of these things. It's really not funny. And we should be wiser. We should be more serious about these things and speak in the affirmative and the positive to our men and say, well, babes, I'm there with you. Go out. I'm very happy that you've taken that step. Let's see what the results are going to show. That's the type of conversation we should be having, not a joking matter. Let's hear what this caller has to say. Good morning to you, caller. Thanks for calling.
Good morning, Carlton, and good morning, Trudy. How are you all doing?
Good morning.
We're doing very well. Good morning.
Good. Carlton, the temperature outside is better today.
Yes.
It is. Sounds like Pastor Rodney.
Yes, it is.
That's pure, right?
Yes.
Carlton, I heard you this morning and I had a little laugh. Because the very first time I did, how you call it, DRE?
Yes.
Yes.
I actually cried before I did the DRE,
You cried?
Yes. and it wasn't when I did the DRE, it was before. In other words, I told myself that I needed to do it. And I tell you something, I got acute depression.
Oh, boy.
So I understand some men's position as far as that's concerned. The truth is now, when I finished doing it, I thought, okay, that wasn't too bad after all.
Oh.
You maybe ask the doctor, you finished now?
Right. And my doctor, this is Paul Ricketts, is the person who did that for me at the time. And he knew. I told him before, listen, I'm coming and we need to do this thing. But I am totally traumatized. He said, it's all right, but I understand how you feel, but we are partners, so we're good. And when he was finished, I said, wait a minute, you done? He said, yes. I said, okay, thank you very much. And we sat and chatted about it for a while, and he said, you see, well, it's not bad. It's not too bad. So I've been encouraging men actually to get it done. I don't have to wait for a doctor, for example, to give me
an appointment,
a request for me to go and do a PSC. No, I go to La Falaise and I say, listen, I come to do a PSC and I want my results. So I've been following my PSC results from the time I was 42.
Wow.
I know where I am, what is happening and so on. And I really encourage men to go and do this because you have a better handle of yourself.
True.
When you know where you are and you know what you have to do and you know what you're doing. But then we have that, and coupled with it sometimes, and you are the medical person, you can clear it up for some of us. Coupled with that, we have the pressure on our minds because a lot of us don't do it, but we're thinking about it, Carlton.
I know.
And in thinking about it, our blood pressure rises and we create more trouble for us.
Because we're thinking of the outcome. What if it's bad? What if, because many men have seen men come to my office, they have seen a few symptoms. And they just tell themselves they don't want to know because they just feel that if it's cancer, they will die.
That's right. But if it's cancer, you will die, yeah, but if it's not cancer or if it's not yet cancerous, or if you can do something about it, do it early.
Right.
And we try to encourage men to do that. In fact, at our church, I say to our men, if you're afraid, come and have a chat with me. I'll go with you,
I love that. Yes.
right? I'll go with you and
Support.
get it done so you at least know where it's at. And I tell them that it's for your good. It's your health. I compare it to when my mother gave me Antipa for the first time.
I remember that. The womb's anti-pedible medicine.
Right? And I roll on the floor, I cry and everything else, but of course. So I'm glad that you're doing this, and I just want to encourage men as a man myself who's gone past the number 40, that it's a good thing to do. Check yourself and check yourself annually too.
Right.
Make sure that you're all right, and because it will save you feeling bad. It will save you getting hypertension because you're worried, and then you can handle your manhood better, if I may put it.
I agree.
All right.
True.
So thanks for that.
Thank you.
I like that.
Yes. Thank you, Pastor. Thank you so much.
Yes. And Pastor Rodney makes such an important point about the anxiety, because really and truly, sometimes when we're avoiding these medical screenings or tests or whatever intervention it is, what we are really doing is added anxiety on ourselves, and prolonged anxiety can never be good. So he makes a very valid point on that.
And I like the how he closed, because the prostate gland has a major factor, a major function as it relates to our erection and our sperm count as well. So if your prostate is already compromising, it may impair the status, your consistencies in having and maintaining an erection. So that is something too as well. You can also develop prostatitis, which is an inflammatory condition of the prostate gland, where you may have a lot of pain and burning. You sit and you have difficulty because you're feeling that pressure towards underneath your testicles, close to your rectum. You're feeling that pressure there. Again, that is something that would warrant antibiotics and anti-inflammatory agents. That is why it's important to have these conversations and, again, make it serious. As I've said, for the ladies, the wives, it is not something that's funny. We should not be making a joke out of it.
That's all.
And we should encourage our men, be more affirming, be more affectionate, in the sense that you showing support to the man. You letting him know that, listen, I'm here with you. We're in this together. And maybe you can even say, well, today is our health day. You go to see your urologist or your doctor. I'm going to see my gynecologist. And all of us have our tests. We know what we're doing, and you can do that.
Carlton, and it's my belief, that in relationships, committed relationships, or I don't know if it's marriages, whatever it is, a relationship, you need to hold your partner accountable for their health, and it should be a dual thing. So it's not you as the woman, and I will talk directly to the ladies. You go in for your pap smear, you run into the doctor for your checks. You're doing your breast self exams, or you go into the physician to do a breast exam for you. You're doing your mammograms, you're doing this, you're doing that, because the ladies tend to have better health seeking behavior. That is a fact. But you have a man living with, you have a man you're married to, you have a man you love, and you're not holding him accountable for doing the same for his health. So I feel like it should be something in a relationship where, hey, we're together. I do my part, you do your part. We encourage each other, and we hold each other accountable for maintaining our health.
Well said. I like that. All right. So what are we going to do? It's now 10:50. We're going to switch gears. We're going to take a break, and then we will focus a little about the elderlies and their medications, because that is one of the troublesome areas in the elderly care. Many of them are on many medications for different medical conditions. Some of them do live alone. Some of them, they get medicines from private pharmacy and from the government system. And sometimes they may have the same medicine with different names, and they are taking them not knowing it's the same medicine. So we're going to discuss that a bit as we, again, the month of September is the month of the elderly. So we're going to switch gears and we're going to be talking about the elderly and medications when we return.
I woke up this morning feeling real stink. I had the intentions to call in sick, but I end up in Jolly's pharmacy. Great and down King George Street, Jolly's fix up my immune system. Got me feeling fit and strong, now I'm ready to work and pick on any mission. If you see me walking, Jolly's pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up the immune system, Jolly's walking. Yeah. Yo, Dominic is the boy Father Box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare. Introducing Jolly's Pharmacy, brand new website, www.jollys.gm. It's your time to jump the line. Shop now at jollys.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollys.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollys.gm. Jolly's Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
So we're back with you here on a very cool Wednesday morning here in the studios of the big station, QFM. As they say, if you did not hear it on Q, then it is not true. So again, we are switching gears and I want to focus a little on the elderly. As you know, month of September is also seen as the month of the elderly in terms of awareness, in terms of care, in terms of just focusing on them entirely. All of us, if we live long enough, we will become elders at some point in our lives. And it is important that we treat our elders with respect, with dignity, with empathy, and with honor. It is very, very important. I grew up in a society in the early 70s where every adult was ma'am and sir. Up to now, it is still applicable to me. And so once I know you are older than I am, yes, ma'am, yes, sir. I respect, and that's how I was taught, and I still hold this very, very, very valuable. The elderly, they are very precious. They have worked very hard for us. They've worked hard for our country. They have, done a lot, and so we need to take care of them. I want to focus though a bit on the elderly and their medications. We know that at that age, you are more likely to have medical conditions. And we're talking about all types of medical conditions that may be affected or could be associated rather with all or any of the body systems. So it could be a cardiovascular, circulatory medical condition. It could be a muscular skeletal condition. It could be something to do with the reproductive system, the endocrine system, the nervous system, any of those systems. And so we know that the elderly are more likely to have arthritis. And we know that there are different types of arthritis. They are more likely to have glaucoma. They are more likely to have diabetes, hypertension, cardiac problems, problems of the heart, problems of the skin, problems with the ear. They are more likely to have hearing loss, problems with the mind. They are more likely to have dementia, Alzheimer's, Parkinson's in some cases, and so most of the times when we visit our health centers or we visit our doctors' offices, we see the majority of people that are there are the elderly, people who have passed the age of 60 and counting.
Mhm.
So it means that more than likely they are on medications.
Right.
They're on medications.
And on several.
And on several.
Mhm.
So let's look at an example. You may have a parent, an aunt, an uncle who was diagnosed with diabetes. And we talk about the new non-insulin dependent diabetes. So they're using pills. So they might be taking metformin, glyburide, and Genomets, these medicines. They might be taking an oral medicine. Okay. But while they have been going through the diabetes, they develop high blood pressure. So that's number 2. They develop high blood pressure. Along the way, most of the times, if you have diabetes, you will more than likely end up with high cholesterol. So, test was done, found out the cholesterol levels are up, right? Hyperlipidemia, that's up. That same person has arthritis, and so they might be on a anti-inflammatory agent, what we call an NSAID. They might be on an NSAID. They might be on some calcium with vitamins D to help with the bones, and the doctor might say, okay, let me give them a rub as well. So let me give you a Voltaren rub. Okay, that same person might have low blood and may be given folic acid plus iron tablets for the low blood. Okay? And the doctor might say, for the appetite and energy and the nerves, let's give some vitamin B complex too. So you have vitamin B complex tablets. So let us say with the diabetes, they're on 2 medicines. With the high blood pressure, they're on 2 medicines. With the cholesterol, they're on 1. For the pain and inflammation, they are on 1. Plus the calcium with vitamins D tablets, the Voltaren gel, the folic and iron tablets, that is 1 medicine, and the B complex, 1 medicine. So they're on 2, 4, 5, 6, 7, 8, 9, 10. 10 different medicines. All right? And the 10 different medicines, which are in 1, 2, 3, 4, 5, 6 different conditions. Now, that person is an elderly person. They might be 75 years. Let us play that devil's advocate. They never really had formal school. And so they're not so literate. All right? They can understand some basic things, but they're not very literate. That individual lives alone. Okay? That individual goes to the health center and they get metformin. They get their metformin, but they didn't get the glyburide, so they have to come and buy it. Okay? Now, at the health center, in our system, they still write on plastic bag. So let's say the pharmacist who wrote may not have the nicest of handwriting. So that pharmacist writes, take 1 pill daily. Doesn't specify what time of day, doesn't specify whether it's before meals, whether it's after meals. Just say 1 pill daily, 1 tablet a day. Put the 30 tablets in there, seal the bag, give it to Granny. Okay? Granny now comes to a private pharmacy where there's good labels, and they say, well, glyburide, take 5 milligrams once a day, preferably after breakfast. So Granny knows that. And they explain to her. The cholesterol medicine, Granny had some, but she didn't know it's really cholesterol medicine. She had a refill. While she's at the health center, they replenish it for her and they give her more. So let's say Granny had Lipitor as the brand drug, but then when she went to the health center, they gave her atorvastatin, which is the generic name. Granny now doesn't know it's the same drug. So Granny sees, take this one at night, take this one at night, and Granny decides that's what she's doing. But it's the same drug. And so we see these things happening. And I like the example that I'm using because it is true. And we see that happening a lot in the elderly. So you find now what's happening, Trudy, is that you are more than likely going to have overdose.
Right.
You are more than likely going to have major side effects. You are more than likely going to have shooting in blood levels of some of these drugs where they should not be, the level should not be, right? You are more likely going to have compromise of vital organs. So, yes, the medicine is good, but who is monitoring and guiding Granny
The
with
amount.
her medicines? Because she's home alone. Children are living in England and the US. Yes, they send the barrel, they send all of that, but she lives alone and she has no knowledge of all of these medicines.
Oh boy. And that's a very normal scenario you just described. Really, people have migrated and the elderly are on their own.
Mhm.
So very in our country, very, very typical
Right.
example.
So, Trudy, what I have done personally, I have done that. I have asked, and I've done that right here on this medium. I've asked the elderly, or if you're taking care of your mother and you recognize mommy has so many medicines, you really don't even know if it's the same, if it's different ones, and you're confused, kindly bring them to us. You can bring them to us. You can bring them to your pharmacy at the hospital, and the pharmacist has a right to sort them out for you, to sort out the medicines for you, right? One of the things that you can also do, you can buy the pill organizer. So you have Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. The pill organizer, if you are a caregiver or you're taking care of your mother, you can come to the pharmacy or you can be at home and you can put the different medicines in there. But again, you have to be able to understand how it goes. And if you have difficulty, again, we can help you. I have done chats for people where I have sat down and I have written down mornings, afternoons, evenings, nights. So evening is between 6 and 8. After 8 is night.
Okay.
Right? And so we will put down what you have to take in the morning and at what time you should take it, what you have to take in the afternoon and at what time, which drugs that need to be spaced out. Because a lot of the times people do what they do is that all the morning pill, they put them in their hand and they swallow all together. And you could have drug interacting with each other negatively because some drugs should not be taken together.
Okay.
You understand?
So that's very important
That-
information.
Yes. And these are things. So for example, if you are taking amlodipine, you cannot take amlodipine together with calcium. You see? So you might take your amlodipine in the morning and at the same time you have your calcium tablets for your arthritis or your osteoporosis and take it. Right? You're going to have the calcium inhibiting the absorption of the amlodipine and affecting how the amlodipine is going to work.
Right.
So that is why it is important, particularly in the elderly, for us to have that conversation relating to medications and the elderly. The elderly are more likely to abuse drugs. They are more likely to hoard medications, right? They're more likely to do that. They are more likely to not store them the right places. They are more likely to forget to even close them properly. And so you could have oxidization taking place where the medications could lose their potency and they can lose their color, right? They can become more brittled when oxygen gets into the bottle and they can actually lose their purpose. So you could have some of these medicines could be stored in an area where the sun comes a certain time in the house and could affect these medicines, whether it's liquid tablets or whatever it is, because Granny doesn't know better. She puts it there on the table. The sun comes in a certain time of the day. It stays on that table for a couple of hours. all of the medicines is right there on the table, the sun is hitting it, it can impact negatively the efficacy of
the
the
drugs.
medicine. So all these things, we've seen people too with medications in very dirty containers, dirty plastic bags, Ziploc bags, dirty bags, dirty stuff. And can you imagine the microorganisms that are lacing these medicines? So yes, you are treating a condition, but the pill is contaminated with microorganisms because it's not stored in the right place. The home is not very hygienic. Mommy or daddy's hands are not properly cleaned. Maybe they're an elderly person. Maybe they don't bathe every day. They don't have sometimes they don't have the right utilities in the house, or the right what do you call this? Hygiene,
The sanitation
right?
It's not
You don't,
correct.
right, you don't have that available. All of these. The other part about it truly is that you recognize it's very comprehensive. The meals. What foods are these elderlies taking with these medicines? Are they contraindicated with some of these medicines? All right. So granny's taking, for example, Lipitor for the cholesterol, and granny doesn't know that she cannot take grapefruit juice with Lipitor. So grapefruit season comes in November, October. Granny love her grapefruit juice, and granny takes it. Right? Or granny's taking iron tablets, and granny love her milk. She loves her milk. And so when she's taking her iron tablet, she takes it just after or while she's drinking her milk. She cannot take iron tablets together with dairy products
Right.
because she's forfeiting the whole. The iron is not going to be absorbed properly. So these are things that are very, very important when it relates to the elderly and their medications. Do they have food to eat whilst they are taking
With
these
the
medicines?
medication.
So you don't want, if the same elderly grandpa is on an NSAID, a non-steroidal anti-inflammatory drug, these must be taken with food because they can irritate the lining of the stomach. So you take them whilst you're eating or just after you've eaten. But granny doesn't know better, or granny doesn't have an appetite, because oftentimes they can be very picky eaters. She doesn't have an appetite and she just takes it. Let me take the painkiller la doctor la bamwe, and the time that you think of it, granny has been taking that for 2 weeks. Granny begin to pass blood in her stool, right? She developed an irritation in the lining of the stomach because the medicine caused that. She didn't know that she must take food with it. So we need to know those things. Are the elderly eating sufficient food? Do they have food available to them? Is there good sanitation in the house? Are there multiple drugs that could be the same medicine but different brand names, and they do not know the differences, and so therefore they get confused and they take them? As it relates to control drugs, some of us, we have elderly people who are using an antipsychotic drug. They might have psychosis, they might have schizophrenia, they might have depression, they might have chronic insomnia where they cannot sleep, and the doctor might give them things like Cogentin or Haldol or this kind of drugs. How are they taking it? Who is monitoring them? Right? So what if granny decided she took one Haldol, one Cogentin, she couldn't sleep very well, she decided to take 3. Right? She decides to take 3 tablets to send her to sleep. She lives alone. She lives wherever. She takes them. What happens then? So when it comes to the elderly, we have to really be cautious. We have to really pay attention to what they're using. And I will tell you too, the elderly, a lot of the times, they discard medicines. They throw them away. They don't want to adhere to the medicines. Some of them, they're fed up. They don't want to take them. They hide them under their pillow. They put them in their socks. They put them in their underwear. they hide the medicines. If you know your parents, your grandparents are taking medications, ensure that you're there to give them the medicine and to see them take the medicine. Sometimes they can be very tricky that they can put the medicine, the pill, underneath their tongue or on the side of their mouth and make you feel that they take the medicine. They didn't take it. For those that are diabetic, a lot of the elderly too, they love sugar. So they get this craving for sugar, especially when the sugar level is high. That's the time they get the craving even more. And that is the time they will more than likely want to hide sweets or they will hide candies to eat them. So you go, you give them whatever you're giving them. They might take that same pill, do not take the pill, hide the pill, but they have a candy, they have a sweetie, they have something underneath their pillow that they were going to use, that they're going to take or eat without your knowledge. So be conscientious. Try not to have these things in the house if you're taking care of your elderly parents and you know they may have a sweet tooth. Avoid bringing all these candies in the house because it's not fair for you to have them eating, have them all over the house, and granny, they're telling granny, you have your sugar, you need to control your sugar. You cannot eat sweetie, but then everybody's saying you eating sweetie. And every other person, how would you feel if it were you? And knowing that her craving is high for sugar. So these are things that we have to be aware about, and we have to do what we have to do to help our elderly. Should I
So,
don't to add anything?
So, Carlton, from your from your scenario that you've painted, it seems to me like medical consultations are necessary, and they are necessary all the time. So it's I think it's something that maybe a lot of people overlook, having a consultation on the how to take medication, and not just what medication to take, but the how, because you've brought up a lot of things that can occur that maybe a lot of people have not thought about, the contraindications between certain drugs and with certain foods too, the timing of the medication, the the interference with one medication and another. So some of those things, I think if people have a consultation when they are prescribed the medication, or the caretaker has that consultation, then we can maybe avoid some of the problems. But I know a lot of people just think getting the medication is it. So you've purchased it, or you've given it to the person, and that's it. But everything you've described there needs to be discussed, and on an individual basis, I guess, with some people, because different people have different habits, different eating styles, different times that they eat and they operate. So I think individual medical consultations is a good idea. I know you're saying that they can come to the pharmacy and show what they are taking and ask. And I would hope in the public system too that they can do the same thing.
And I'm really liking that statement that you're making, because again, it indicates that all of us as healthcare provider has a role to play in this, because it's one thing to have granny in the room. And oftentimes, sometimes because of their age, they might be speaking Creole. They don't understand all this fine talk. You need to explain that to the caregiver as well, the next of kin. If it means that there has to be a family meeting where we explain, okay, mommy has XYZ. She's going to be on what we call polypharmacy, meaning she's going to be on multiple drugs. The drugs have to be given at specific times. What I'd advise you to do, whichever pharmacy that you're accessing, ensure that you ask the pharmacist to put them in categories for you, so you can know, well, morning time is amlodipine, folic acid, benzofuroxide. Afternoon time, calcium with vitamins D, Daflon at 12 o'clock. Night time, I'm going to use my Timonol eye drop, blah, 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 blah. And at what time? So you have that spacing. Sometimes it can be a bit difficult because when we look at the pharmaco dynamics, you're looking at sometimes how these drugs affect the organs. We're looking at the main the detoxifier or modifiers in the body, the liver, the kidney, and just the small intestines. We're looking at that, and we sometimes you're looking at so many drugs. How many of these drugs have to be the same organ has to break them down, and it's sometimes difficult, and that's why as pharmacists sometimes what we advise doctors to do is to try to sometimes look for combination drugs. So it minimizes the number of drugs. So if you can get combinations, if there are combinations, right now there is the combination of metformin and glyburide.
Okay.
Right, there's that combination now. So you don't have to, so it makes it easier for the patients to take the medicine.
And Carlton, I wanted to mention too, and maybe ask in terms of quantity of pills, because okay, you've mentioned, for instance, in your going back to your scenario, somebody may have 10 different medications to take. They have multiplicity of conditions that they're dealing with, and then some of the medications, based on the dosage, they may be more than one pill. So, for example, you on 1,500 milligrams of metformin a day, meaning three tablets. So you have 3 of those. And then you on some other medication where it's however many milligrams. So it's, what about the combination of dosage in terms of the pill? Instead of it being like a 500 milligram pill, there is a 1,500. Like if if the person is taking it once a day, you know what I mean? Because I know another thing that can be very difficult for people is counting out, their medication. You mentioned it out into the everyday. What is the name of the container? Like the
pill planner.
Yeah, the pill planner. But like counting out multiple pills can get confusing for some people. So is there a way too that maybe somebody can speak to their pharmacist about the prescription being more, I don't know if the word is condensed, but like the quantity, depending on the quantity that they are prescribed, like the dosage being given being dispensed in a bigger pill amount. I don't know if I'm explaining it properly.
I'm actually liking the way you're asking the question, because it's exactly the way that a patient would have asked the question.
Yes.
So I'm liking it, and you're not making it too technical. No, that is a very good question that you've asked, because in pharmacology there are different concepts. You have bioavailability, you have half-life, you have all these concepts to deal with when you're dealing with a drug. Every drug has what we call a half-life. The length of time it gets to the bloodstream at its highest peak, and the time it begins to clear out from the body, right? Now, when medicines are prescribed to any one of us, there are several factors that are considered. Our medical condition, of course, our weight, our weight as well. We have to look at our age, the dosage. Is it appropriate for that age? We have to look at underlying medical conditions. Are there other conditions that this medicine, based on how it's given, may cause more complications to the patient? So you have to look at all of these factors before you can actually sit and look at the regimen. Okay. Now, let us say metformin is one of those drugs. Metformin is a very good example, because it is one of the first line treatments that is given for type 1 diabetes. Type 2 diabetes. Type 2 diabetes. However, most people end up having GI, gastrointestinal upset from metformin, diarrhea, nausea, upset
Some people say bloating. I've heard they say bloating.
All of that. But again, your dose has to be dependent on your blood chemistry. What is your sugar ratio like? When you've done your glucose tolerance test, your insulin resistant test, your HbA1c test, all of these, the doctor is looking at all of these results to determine what is the best dose for you. Now, Some doctors may use the long-acting rather than the short-acting metformin, particularly when you complain of these types of side effects.
The extended release.
People have seen reduction in the side effects, but it's not just something that you can just say you can do on your own. There are many factors, as I said, that must be considered. So the best thing to do is to have that conversation with your prescriber, the doctor,
okay,
and they will help you. Sometimes it's a simple thing of just changing the drug and putting you on another class of drug that may sort of warrant or give you the same benefit as the one that you were using.
Because some people, and I know I in particular, don't like swallowing tablet, don't like swallowing pills.
Yes,
so you start thinking, okay, how can I condense what I'm taking so I don't have to swallow as many pills? You know, if it's one, if it's instead of 3, if that can be combined and it's one I have to take, you know, that might be more comfortable for me and maybe assist in adherence. Because you mentioned, Carlton, we were speaking about elderly, you know, some elderly people might not want to adhere to what they have been prescribed. They hide in the medication, they don't want to take it, and it might be because of a discomfort for them. They don't like swallowing that. They don't like the taste of that when it starts to dissolve in their mouth. They don't like, you know, so we have to, I guess, to think about what is going to assist best with the adherence, because that will provide for better outcome for the patient. So speaking to the physician, which is what you just mentioned, is key. And I don't think people should be afraid either to say, you know, doctor, I want to take less pills. What can you prescribe that would lessen the number of actual pills, or how can I do this differently? Or, you know, this is prescribed to take every morning, but I normally wake up very late. So what does that mean for me when you say every morning? If I'm waking up at 11 o'clock, is that considered to be still morning if I take it at 11:30? You know what I mean? Or minutes to 12. So I think the conversations have to be there between the medical practitioner and the patient, and as well with the caretaker. And if we're speaking about the elderly patient, the caretaker and the medical practitioner as well. So the caretaker is on the same page.
And again, very, very good contribution that you're making, because these are very, very important points. Because some way, somehow, we are all impacted. We're all impacted. The other thing too is, again, the medications can vary, and there are many factors relating to choices, because medicines, what I want is that some of these conditions, because they are lifestyle modifiers, they are caused by lifestyles. Suddenly the doctor may have to just tell you, well, if you want your dosage change, this is what you need to do. You need to reduce your XYZ in your meals. You need to get on a serious exercise program. You need to XYZ, and these will also help to reduce your numbers. So if you inculcate this into your lifestyle, we may see a reduction in dosage of your medicine, right? Especially when we're talking about the chronic non-communicable disease like diabetes, high blood pressure, high cholesterol, and all of this. They would normally tell you, okay, your triglycerides are high or your LDL is high. This is what you need to do. These are some of the foods that you need to reduce, and these are the foods that you need to increase on. And that's what we're talking about. So it's not just merely just factorizing the pharmaco aspect of it, the pharmacology aspect, but what can I do from a health and wellness perspective to reverse, reduce, and maybe even actually stop taking medications, right? Trudy, it is now 11:25. We have 5 more minutes, and we recognize we've dissected our show because our guests didn't come, and we just had a real good show.
Yeah.
So let's talk a little about, in the last 5 minutes, Caribbean Wellness Month.
Yes,
We know that it was the month of
September.
Caribbean Wellness Month, and many health districts
Had activities, yeah.
There were quite a bit of cardio jams,
Yes.
and diet competitions, and no bread days and all of that.
Last week, I know Roseau, I because I mentioned some of them last week on the show.
Yes.
Roseau Health District had a major health fair in the Windsor Park Sports Stadium forecourt. I believe it was Friday of last week. So the different health districts definitely put on different. I saw one for the Salisbury area. They had a dance something on the playing field. So there was a definite push for health and wellness, to increase physical activity, increase awareness about lifestyle and how it can impact health. I saw a lot of activities planned.
And there were many public health education as well. I did one at the Gospel Mission Church in Caneville. I was scheduled to have done one last night and call you. Unfortunately, there was no light. And that had to be postponed because of that. And I was asked to come to speak to men on men's health last evening. So we saw quite a bit of that too happening throughout the island. And I really want to encourage us to not just wait every September for Caribbean Wellness Month to have these activities going on. If you are from a community, like if you're from, like, let's say Dublin, and Dublin is a large sporting community, 2 or 3 of the sports people right there can develop a club, a wellness club. And if you decide every twice a week we're going to meet and we're going to have exercise classes on our savannah, we do that. So we can begin these type of practices throughout all of Dominica. You have net ballers, you have footballers, you have table tennis, you have people that are into sports, and they can actually begin that catalyst, start that going in their community, have a sports club, have some cardio jam, have some fitness classes, get people moving. And you can even decide once a week you're having a class for people above the age of 60. So those that at that age can come, and you tailor-made, little exercises for them. You can tell them walk with 2 small bottles of Lubia of water, so that they can get their tone. So we can do things like that. We can still have hikes. We can still have a swimming club. So we can have swimming. We have those of us who are blessed with beaches. We can have people run up and down the beach, like a little military style, and give them incentives. You can even have community members donate water, for example. So while we have the class, everybody walk to the class for donation. Everybody put $3. Then we have how many bottles of water? Of water. Everybody can get a water at the end. So we can do those things. Our nutrition. This morning I spoke about the interpretation of food labels and how we read them. I gave an example on DBS this morning on Health Pulse, and this is something again we have to be very, very much aware of, and we need to be educated on. We need to spend time on food labels. How do we understand them? What is a portion? How do we quantify and calculate grams to teaspoonfuls? When we're consuming things, and so that is another conversation that we will have very, very soon. I will actually come and do a few of examples for you, how you read food labels and what a serving size is. So that is something that is important. And again, being concerned about you. Look at yourself in the mirror. Do you like what you're seeing? Do you like what you're seeing about yourself? Can you make some changes? You may never be a small person, but at least you can be a big, healthy person. And health, as we said, does not mean the absence of a disease. It's how can I prevent that disease from creating complications for me? So yes, you can be a diabetic and be a diabetic without having to have an amputation, without having to lose your sight, or without having to what else?
have nerve pain
to have
or,
right
or
to have nerve problems
Mhm.
because you're doing the right things.
Mhm.
All right. So these are some of the things we wanted to talk with you about, a chit chat day.
Yeah.
We recognize the lines were a little quiet today.
But cousin, we did have
We had a
before we close. I
Yes.
just wanted, somebody made a comment on our Facebook page,
Yes.
re the refrigeration of medication and how it's
Ah,
been impacted by the loss of electricity
That's a very good
crisis
one.
that we're
Right.
going through.
Let me give a tip on
Uh-huh.
that.
Mhm.
Right. So now is a good time if you have when you can make ice, make ice.
I was thinking exactly
Have an
that.
ice pack. So for those who are using insulin, it's a good time to have an ice pack. Make some ice, put them there. It's a good time to have Ziploc bags as well. You have some Ziploc bags for children who are using antibiotic in suspensions that's supposed to be refrigerated. You can actually put the antibiotic in a Ziploc bag and just put it in water. You can just put it in room temperature water or cool water and leave it in the Ziploc bag in the cold water. So it
Mhm.
will help to keep the temperature at a good
At the
place.
same-
Yes.
And I also want to tell people, stop opening those fridges when
Yes.
when the electricity is
Yes,
gone,
yes.
because that will also ensure that the
course.
fridge keeps cool.
And now
So-
we have self-frost. Right.
Right.
No frost fridge.
Because I see a lot of people talking about their food has spoiled or whatever. But
Mhm.
I know if you, at least to prolong the life of the
True.
things in the fridge, if you just keep it closed, don't go looking in that fridge when you're in that electricity crisis that we have
True.
right now.
Sure. All right. So it's 11:32. We have to say goodbye to you. It was a pleasure again bringing to you Health Vibes, your very own health talk show brought to you by the brand new trust, the most Jolly's Pharmacy. I was your host, Carlton Lando.
Trudy
All
Christian.
right. As always, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and remainder of the week. And if you live in a low-lying area or an area that is prone to landslides and so forth, be conscious, be wise, look around you and be safe. Take care, everybody. Have a good day.
Bye-bye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Christian.